A pleasant day to everyone. This will be the fifth part of our lecture series on drug abuse. For this session, we will talk about the management or treatment of drug abuse in the Philippines. The treatment of drug abusers in the Philippines still relies on rehabilitation. Okay. So, for the initial part of the treatment of drug abuse, what we usually do in rehab centers is to do detoxification. This will be for 2 weeks. These are the common drugs used for detoxification, but unfortunately, in the Philippines, only naltrexone is available. And these are the different modalities of treatment employed here in the Philippines. In the Philippines, 99% of the rehabilitation centers use the therapeutic community approach. Only two rehabilitation centers use the Hazelton approach, and one of which is my former rehabilitation center in the New Beginnings. Sorry. The Seventh-day Adventist has their own rehabilitation center, which uses the spiritual approach. The Dangerous Drugs Board Rehabilitation Center in Quezon City uses the eclectic approach, which is a myriad of the different modalities of treatment. This is a typical daily regimen in a Narcotics Anonymous therapy uh, treatment. Okay. Pull-ups are when you commit a mistake or an infraction of the rules. You will be asked to sit in the middle, and the other patients will sit in a circle around you and tell you of the consequences of your infraction and how it is not good for you and for the whole family. This is the famous serenity prayer expressed before each activity, which everyone may adopt in their own life. Okay, so God grant us the serenity to accept the things we cannot change, courage to change the things we can, and the wisdom to know the difference. This is the typical therapeutic community program, which lasts for 24 months. And these are the aftercare programs available for those who have finished their rehabilitation. So this is to prevent relapse. Okay. Aftercare is required by law and lasts for 24 months. In aftercare, you will go back to the center every week at the scheduled time. Counseling is still done together with random drug testing. If you test positive, then you go back to rehabilitation or go to jail. Halfway home is for people who still cannot go to their own home, usually because it is in their home that the triggers for relapse are present, just like having drug dependent parents. In the halfway houses, you go back to your daytime routine of work or school, but go back to the rehabilitation or halfway home in the evening. Support groups are the big brothers of Narcotics Anonymous and Alcoholic Anonymous, and this is always accompanied by NA meetings or AA meetings. This study shows that rehabilitation works. This is a research I conducted in 1998 in which I followed up patients released by Narcom DRC 5 years after the release and attempt to determine what was happening in their lives. Narcom DRC in Bikutan is a government rehabilitation center. As compared to private rehab centers where one patient may have 1 to 3 counselors, in Narcom DRC, one social worker is responsible for about 200 drug dependents. So it is not the ideal setting for rehabilitation. However, despite this limitation, you can see that rehabilitation still works. Only 27.1% of those released relapse, and 9.7% are in jail. More than two-thirds are still drug-free 5 years after. For the last session, we will talk about the government programs for drug abuse.